My name is Dr. Ivy Branin. I'm a New York-based naturopathic doctor. And you might have been reading all over the internet about this thing, SIBO, or also known as SIBO, S-I-B-O, and you might be wondering, what are we talking about? So SIBO stands for small intestinal bacterial overgrowth. And basically, it refers to an infection, or considered an infection, of the small intestine. But in some ways, like calling it infection is a little bit of a misnomer. And what we're really talking about is that either there's an increase in certain normal occurring small intestinal flora, bacteria, or an increase in production of pathogenic bacteria, or having bacteria that would be from a different area, say the large intestine. So it can be any kind of imbalance in the small intestine. But really, fundamentally, it's not so important exactly what bacteria, although we will talk a little bit about treatment and the different types of bacteria that could be forming, but more about what are the symptoms and how would one know if they have SIBO. So classically, a lot of the symptoms that people experience with SIBO are similar to IBS, irritable bowel syndrome, whether it's IBS-D, IBS associated with diarrhea, or IBS-C associated with constipation. Also, a lot of the symptoms of SIBO are very similar to other conditions like ulcerative colitis and Crohn's disease. So some of the obvious symptoms are constipation and diarrhea due to the imbalance of bacteria. Also, abdominal pain, usually associated with the gas produced by the bacteria. Belching, hiccups, I've actually seen that in my practice as one of the only symptoms of SIBO. Acid reflux, so those are some of the GI type symptoms, also really bad abdominal cramps. But other symptoms could be restless legs, one of the reasons being that the bacteria do affect the absorption of certain nutrients, so we can see restless legs. Also skin manifestations, things like acne, things like eczema, mood changes. So there's a lot of different symptoms that one could experience with SIBO, and so it's always good to look at as a possible root cause of a condition. So why does even SIBO happen? So some of the main causes are stress, antibiotic use, low stomach acid, poor immune function, and something we call dysmotility. So stress. Stress has a big impact on our digestion, and basically when we're we're in that flight or fight mode versus the rest and digest, so very much in the sympathetic versus the parasympathetic, a lot of things happen with our digestion. So basically a digestion somewhat slowing down or turning off. The big thing again, some of the big things are low stomach acid, and might as well just tie that into the other, which is low stomach acid, why that would even cause a disruption in the bacteria is that basically if you have low stomach acid, you're just going to be allowing bacteria that wouldn't normally be in the small intestine to get into the small intestine. Also, during times of stress, again, because you're not really activating digestion, you're going to be slowing down motility, you're going to be slowing down not just the secretion of stomach acid, but also our different digestive enzymes. So it's just throwing off digestion, and the longer that is happening, you're much more likely to land in having SIBO. Also, again, another big factor too is that during times of stress, one can be more likely prone to constipation. Constipation in itself can also lead to small intestinal bacterial overgrowth. Antibiotic use, I think that could be quite obvious, but most antibiotics that we use are systemic, meaning that they're not localized to the area that we're wanting to reduce a bacteria. So we might be killing bacteria in our ear or killing bacteria in our nasal passages, but that same antibiotic is also killing our healthy flora in our GI tract. And during those times, specifically if you are not taking a probiotic before, during, and after the antibiotic use, you're just leaving yourself very prone to opportunistic bacteria. Also, the antibiotic itself can definitely affect the balance between the different types of normally occurring bacteria. As I mentioned before already, low stomach acid, as it pertains to stress, but there are also conditions that can lead to low stomach acid besides stress and anxiety. Those that follow more of a vegetarian or vegan diet for long periods of time can have reduced stomach acid, plus being on a proton pump inhibitor, a PPI, which chronically is lowering stomach acid, is going to make it one more prone to SIBO. And then just the fact of aging. So as we age, our stomach acid actually starts decreasing. So that is just something else to consider. Poor immune function. I think this might also be somewhat obvious, but obviously if we're not having a very robust immune system, we're not fighting off pathogenic bacteria. The pathogenic bacteria begins to proliferate and crowding out the bacteria that is benefiting us. And there's so many reasons why we want proper, healthy bacteria in our gut, and partly a lot of it has to do with the incorporation of nutrients, including even omega-3 fatty acids. The bacteria is also very responsible for producing mood supportive substances like serotonin. Sometimes we even talk about the gut as the second brain, and that there's a connection between the brain and the gut. And again, if our immune system isn't functioning properly, we're going to have an imbalance in that bacteria. And then the last one that we often see is dysmotility. And so basically what we're referring to is the movement along the GI tract. And if that is compromised, specifically if we think about like the backing up or constipation, we're not having that nice healthy flush of renewal of bacteria. Something to note is that we have these migrating motor complexes, MMCs, and the MMCs sort of send what we consider a cleansing sweep. And so often those that are prone to SIBO or who have relapsing cases of SIBO have compromised MMCs. And this is one of the reasons whenever I'm working with a SIBO patient that I make sure that they are following proper meal times. Basically, our MMCs get activated after eating, about an hour or two after eating. So if we're chronically, if we're grazers and we're eating all the time, we're not fully utilizing our MMCs. So that's really, really important. Now on to testing for SIBO. So how do you determine if you have SIBO? So in reality, things like stool testing, for example, are not really accurate when it comes to actually determining SIBO. There's only one proven test for SIBO, and that's the 3-hour lactulose hydrogen breath test. And well, in fact, actually, to even be more strong, is that when you are testing for SIBO, besides doing the gold standard of the 3-hour lactulose breath test, you want to make sure that whoever you're working with, whether it's gastroenterologist or alternative practitioner like a naturopath, you want to make sure that they are testing both for methane and hydrogen. So it is possible that if you just test for hydrogen, you might get a false negative because you might be having bacteria that is readily converting the hydrogen over to methane. And we often see, so again, I always like to use the breath test as the way I treat my patient, or determining what is the best course of treatment for the patient. typically, usually we see that patients that are much more prone to constipation tend to be more methane dominant versus patients that are much more diarrhea type symptomology tend to typically be much more hydrogen. The other reason, besides obviously we mentioned hydrogen and methane, the reason that the 3 hour, because there's also the possibility of doing a 2 hour test, the 3 hour is much more comprehensive because you're doing the full small intestine. If you do the 2 hour, unfortunately you're not going to get the full picture. And I definitely recommend getting tested versus just treating based on your symptoms, because the test will definitely tell, one, what kind of bacteria you have, what is the best treatment recommendation, and then also once you've completed treatment, even if you either feel better or even sometimes if you're still having symptoms, the following up with the test is very beneficial in saying where you are in your stage of recovery. So that's testing. So then if you do test positive, what are some of the treatment options? So as a naturopathic doctor, I use a combination of natural antimicrobial herbs, things like berberine, black walnuts, garlic. So there's a lot of misinformation sometimes about garlic, and I'll talk a little bit about this when I discuss the diet aspect of SIBO, but often patients that have been diagnosed with SIBO, perhaps they've been following a FODMAP style diet, and typically garlic, for example, is usually off the FODMAP's list. But when it comes to supplemental garlic, because we're talking about allicin, it does not have like that same effect. So that's one of the I guess the myths around using garlic, and when I mean garlic, I'm talking about the component allicin, which has the antimicrobial. Also, the other big thing, in addition to antimicrobial herbs, which actually studies have shown that the antimicrobial herbs can be just as good, if not better, than the antibiotics. There's been a couple of studies actually showing they have very similar efficacy. So in addition to the antimicrobial herbs, I also typically prescribe specific enzymes to break up biofilms. So basically, biofilms is a film that the bacteria produces to protect itself against the antibiotic, whether it's natural or pharmaceutical. So it's very important whenever I'm working with patients is to use biofilm disruptors via these specific types of enzymes. The other thing that will often, as I mentioned earlier, the importance of motility and really activating those MMCs. And one of the ways that we do that is through prokinetics. I use natural prokinetics in my practice, and some of our main natural prokinetics are high dose ginger, typically with 5-HTP is very good as a prokinetic. Another prokinetic that I'll often use is iberogast, which is a mixture of different herbs that has very much a bitter property. And so that's the main basis of what I do as far as supplementation when it comes to a natural approach to SIBO. So then when it comes to diet, so diet is definitely very, very important when it comes to treating a patient with SIBO. And some of the gold standard dietary approach to SIBO is a combination of FODMAPs and the single specific carbohydrate diet. So basically what that involves is avoiding FODMAPs vegetables or having them in smaller quantities. And so what are some of the FODMAP vegetables? But things like most of your brassicas, unfortunately, things like broccoli and cabbage, they can be consumed, but just in smaller quantities. And then avoiding and looking at more like the specific carbohydrate diet, so the SCD diet. If you've ever read the Vicious Cycle, which is a fantastic book that talks all about the specific carbohydrate diet. And so some of those foods to avoid are things like legumes, grains, most of your starchy vegetables, things like yams and potatoes. And really with that diet, specifically when we think about the single carbohydrate, really looking at just glucose, things like from honey. Also specifically in the early stages of SIBO, most fruits have to be either avoided or have a small quantity. So usually the basis of a SIBO diet is animal proteins, some approved vegetables, some approved fruits, some nuts and seeds, some have to be avoided, some oils. And then another kind of controversial thing when it comes to the SIBO diet is bone broths. So bone broths that contain cartilage are definitely not okay. So bone broths made from chicken, for example, like chicken bones, but using beef marrow bones that do not contain the cartilage, which could be potentially feeding the bacteria, is avoided. Now, I guess another part of the diet, so in some cases, specifically if I've worked with a patient and either we've deemed that their case is very severe, or we've done the herbs, we've done the diet, we do the testing and they're still positive, both cases could be a good candidate for the elemental diet. So the elemental diet is basically a liquid diet, which actually studies have shown it alone on its own actually can be curative of SIBO, though sometimes we will do both elemental diet and antimicrobial herbs. And basically this consists of a 10-day to 2-week regimen of having a liquid mixture that has all the macronutrients, fats, proteins, some carbohydrate, and vitamins, minerals. I will either give my patients a recipe, or there are also some pre-made formulations, and we prescribe them based on the patient's own caloric needs. So that's another possibility of both a diet, but also just even a standalone treatment. Now you might be wondering, so maybe you're not so interested in a natural method for SIBO and you're wondering a bit about what are some of the other options. And there is a possibility of using antibiotics, and specific antibiotics, rifaximin, is for SIBO, and the reason is that antibiotic actually can just reside in the small intestine, so it's not it's localized, and that's why it's the choice when it comes to antibiotics. Some things to note about if you do decide to go the antibiotic route, make sure definitely to include prokinetics, and also again that making sure, so as far as whether again conventional or natural, once we know that we have eradicated the SIBO, it is important to repopulate the gut healthfully with probiotics, gut repair, also giving some prebiotics. Again, I also, in my practice, I don't start the repair phase until we have gotten a clear breath test, because if you start the repair too soon, you're most likely going to get an aggravation, specifically when we think about adding on things like prebiotics, and that could be inulin, that could be slippery elm. These are all herbs that and substances that should be avoided until we have clearance that, that you, the patient, have been recovered. So hopefully you've learned a few things about SIBO, and if you'd like to learn more about SIBO or any other gastrointestinal issues, I encourage you to subscribe to my YouTube channel. That's Dr. Ivy Branin of Simplicity Health Associates. You can also follow me on Instagram, Dr. Ivy Branin, and then also on my website, simplicityhealthassociates.com, I have a wellness blog of both women and gastrointestinal issues and mood disorders. So hopefully you'll be checking out soon. Again, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, and you stay safe.